Good afternoon, everybody. I'm going to speak for the motion. So let's get going. So before I start my presentation, let me give you a small example of a young doctor who joins a group practice, advises his first cataract surgery, and then the patient goes through an array of state of diagnostics handled by highly trained staff, then lands up in OT with state-of-the-art OT with best of microscopes, best of phacoemulsification systems, and if it all required digital imaging system also. Uh, the patient outcome has been very good. Doctor is very happy, and patient then brings in more patient, and juggernaut starts. Now, remember, this has been achieved without investing a single rupee. And imagine the same doctor going solo in today's time. It'll take definitely a few years before he reaches to this level of eye care. Now imagine the second scenario. This doctor completes about 5 years of practice, gets an opportunity to invest in similar model and create another facility. Now the earning continues from the practice, and in the long run, he benefits from the profit of the center. What I just described, in short, was actually my story, which started in 2014 when I joined this BBI group of hospitals in Kolkata. And 2021, I had a privilege of being one of the investors in this wonderful group practice called as Netralayam. So what makes this model work? So time, as we all know, is the most valuable resource which is at us available to us. So every minute counts. The moment I enter the hospital from 9 o'clock to 6 o'clock, every minute goes in the patient care, and and that helps in improving efficiency as well as the focus on the patients. And this I can do because I don't have to get into all these activities of running the hospital. Again, because I work in a group, the clinical skill upgrade is much faster than others, because one of the doctors in the group will may get some new information he will share, and we will implement that. Of course, I can take n number of names as I want. The center will keep running because there are other people who are take care, and with combined volumes of all the doctors are there, we get a better negotiation power with the company, and ultimately we get instruments at a better rate. And aggravate of all the patients, ultimately leads to a much faster brand establishment, as we have seen in last 10 years of these two brands. Now, this has really resulted in a good increase in OPD numbers for me personally over a period of last 5 years, except last year, of course, everybody knows it's the COVID time, and and as well as the OT numbers. So in the end, I would like to ask you, which practice graph will you prefer? A graph which is slow to start with, and most of the practical life goes in waiting for success, and once the success comes, you are at an age when you look at your children to take over, or you want a graph like this where the success comes very early in life and you become financially independent, you can do things other than your practice. I would any day pick up this graph, which is an exponential graph which we see in group practice, versus this logarithmic graph which we see in solo practice. I thank you for your attention.
And I